YouTube Nation and all our Vein911 fans out there, we got a special video for you here today. We have a patient who's been previously treated with laser, who is basically undertreated and still has some symptoms, and we found an untreated vein that needs treatment, and so that's what we're going to be doing here today. Mark has an anterior accessory saphenous vein. The greater saphenous vein is often the culprit vein in varicose vein disease, but most people have accessory or additional saphenous veins, and sometimes those are a problem and are leaking, and if not treated, people will remain with symptoms. So that's what we're going to be doing here today. Little pinch here. Pinch is the worst part, really. And then you can cuss at me, but no fair moving. That's my deal with the patients. They can cuss at me, but no fair moving. I haven't had too many takers. Again, I say it a lot, but it's true. We haven't really had anybody cuss at us, hit me, or leave here at Vein911 for anything that we do. So if someone's concerned about pain and getting their varicose veins treated, they needn't be. There are pretty simple and pain-free ways to get rid of vein disease. So this anterior accessory saphenous vein is pretty small, but if we can see it, we're going to be able to put a needle in it. It's kind of that simple. So we're just triangulating, we're knocking on the door here, and now we made our puncture, and you can see the needle tip right within the vein there. Pull it back ever so gently. You see a little tiny bit of blood at the tip here. And there we go. And this is the vein, to the left side of the screen, and you can see our wire going into the vein. And so that's what we call a bullseye. That's the most challenging part for the physician when we do laser therapy of varicose veins, is just getting in the darn vein. That's really, after that it's all downhill. And part of the challenge is not only, this is like a fancy video game, it takes time and skill and experience to be good at hitting things hitting small things with a needle with ultrasound guidance. But also, patients' veins can go into spasm. There's little involuntary muscles in the veins and things, and it can make the vein just clamp down. Compounded medications are basically made in a corner pharmaceutical, corner store pharmaceutical, and they make the drugs right there in the store, and it's kind of a loophole in the FDA approval process where there really are no manufacturing standards. And so many practitioners, frankly, will use compounded pharmaceuticals, in my opinion, to save money. And there are issues with compounded pharmaceuticals that you can read more about at our website, at our Vein911 website. And so when we say best in class or world-class vein care, we mean it. We don't use compounded pharmaceuticals. Frankly, if there's an FDA-approved product out there, I feel strongly that you're pretty much compelled to use it. If there is an FDA-approved product. Sometimes there isn't, and then we're forced to use maybe a compounded pharmaceutical or a device that isn't FDA approved. But once something goes through the FDA approval process, I feel like you pretty much got to use that to do your best for your patients. So we don't use compounding pharmaceuticals, so before you get your spider vein treatment or varicose vein treatment, I would ask them, are you using compounded pharmaceuticals? You know, are you using FDA approved products? If not, why not? These kinds of things. Anyway, what we've done here is we simply put a needle in the vein, wire through the needle, and then a catheter over the wire. And I am just taking this stuff out right now. And normally we'd be a little further along in the process, but I'm chatting here. Get rid of some of this heme. And so I'm going to give this laser to Miss Sandra over here, who is going to plug it into the laser generator over here. And I mentioned earlier that the laser looks a lot like a fishing line. Looks like 80-pound test, and it's got a little gold jacket on it. How you doing, Mark? Good? Okay. So our laser is in place, and we're just checking the tip of this thing. That looks good. So now that we have the laser in place, we want to put a little bit of numbing medicine around the vein so that the patient doesn't feel the laser when we fire the laser. There's a little pump here. When I turn it on, it pumps out basically mostly saline, a little bit of lidocaine. So I'm going to look at the laser here, and we're going to insert this needle where we've already been. We're not making any new hole here. And I'm going to press that foot pedal, and it's going to infuse this medication. Now this might burn a little bit. If it's hurting you, let me know and I can adjust what I'm doing. How you doing? Fine? Now the big test is, most patients will say, oh my God, that was nothing at all. I can't believe I was worried about all that. And normally my next question is, would you do it again? Most people would. Do we have that much? If we had that much fun, they'd do it again, then it can't be that bad. So anyway, and this is a pretty short segment of vein we're treating right now, and what I'm doing here is what I call a little inside-out anesthesia. I'm anesthetizing the skin from here up, and instead of poking them and hurting them, I got my needle up under the skin. I'm going to anesthetize it, and then I'm going to go through it. And I don't know, that's kind of an IR trick. I'm not sure how popular that is, but a little pinch possibly, or maybe not. So that's what I call inside-out anesthesia. Did you feel that? Are you okay? All right. So anyway, we're putting basically a donut of fluid around the laser. We're not making mincemeat at anybody. This needle is very carefully directed exactly where it needs to go. And a little more inside-out anesthesia here, not down just a tad. That's our laser fiber. You see that bright line across there? I'm kind of waving the ultrasound so it's saying hi. The laser's saying hi to you there. Little pinch. And what you're going to see here is the needle coming down. And you can see that right here. I'm going to jiggle it right on top of the laser right here. See it? It's a bright little thing. I'm jiggling it on top. Okay, so going right to left is the laser, and my needle's coming from the top right corner down. And I'm going to press the foot pedal, and you're going to see, little black stuff go around the vein, and that's just the liquid. And so that's long. Now when I come around and look at this transverse, not sure how to say that in layman's terms, but you can see it looks like a target or a bullseye. And so I'll show you where that is here in just a moment. So my needle tip is literally bouncing off the laser here. And so I'm going to put in a little more fluid. You can see the target kind of widen there. So right in the middle, here I'll put it in the middle of the screen. Right in the middle, correct. Yeah, that's the, there's a laser fiber, and then there's a black target of fluid around it. So anyway, we're going to go back to my preferred way of seeing things, and you see the needle coming down again, and our patient over here can't feel any of this. He's not wincing. He's not cussing. So everything seems to be going just fine, as it usually does. Anyway, we are nearly done here. Like I said, the laser part takes a minute or two at the most. It's just mostly preparation. And I should say that normally we would be having the music of the patient's choice playing right now, but since we're videoing today, I didn't want to do that. But normally we got some fun music going on in here. We have on our blog, at our website, like us on Facebook, subscribe to us on YouTube, and we've got all the information you could possibly want at those sites. And if it's not, give me a call at Vein911. It should be easy to remember, 855-VEIN911. Ask us your question.